Hello guys, it is medical information, and in this session I want to speak about treatment of hypertension. I've previously explained how hypertension is prevalent and it can impose cardiovascular, renal and cerebral complications. So first of all, you should know what is the goal of treatment in hypertension. Generally, a blood pressure of less than 140 on 90 is preferred and is the goal of treatment in hypertension, but a lower blood pressure is preferred in those with renal failure or diabetes or some of the other medical conditions. And how far the patient or the hypertensive subject must check his blood pressure or her blood pressure. Twice a week is the preferred interval. The patient can check his or her own blood pressure, and it can help him or her to notify the importance of the medication and regularly take the medication and improves patient's compliance. But before the medication, lifestyle modification should be administered if the patient is hypertensive. Decreasing body weight, regular exercise, regular anaerobic exercise particularly, and low salt diet are pivotal in hypertensive patients, but smoking cessation and preventing fast foods and increasing vegetable and fruits consumption is also helpful. There are different types of antihypertensive medication, but in this slide I want to show you the most important and the first line medications for hypertension. Calcium channel blockers such as amlodipine, nicardipine, and felodipine are the first choice together with angiotensin converting enzyme inhibitors such as enalapril, captopril. Indeed, calcium channel blockers are safe and they have limited side effects. For example, they can cause minor leg edema, and their safety, the margin of safety, lets the physician to use them in a wide variety of diseases. Angiotensin converting enzyme inhibitors and angiotensin receptor blockers are similar, but they have a little difference in their mechanism of action. The angiotensin converting enzyme inhibitors inhibit the enzyme converting angiotensin 1 to angiotensin 2, but the angiotensin receptor blockers blocks the receptors for angiotensin 2, and the first group, angiotensin converting enzyme inhibitors, also increase the level of bradykinin, which is a vasodilator and can potentiate the effect of these drugs to decrease blood pressure. Angiotensin converting enzyme inhibitors can cause angioedema and cough. So if the patient feels cough and is suffering from cough after using this group of drugs, the patient can stop the drug and use angiotensin receptor blockers instead. Angiotensin receptor blockers and angiotensin converting enzyme inhibitors are preferred in diabetic patients or in those with nephrotic syndrome or other chronic kidney diseases, and they can prevent cardiovascular remodeling and increase patient survival. Diuretics such as hydrochlorothiazide are also the first line medication in hypertensive patients, but in recent years their use has been limited because calcium channel blockers, angiotensin converting enzyme inhibitors, or angiotensin receptor blockers are safer and provide more protection. The patients need to be familiar with the definition of resistant hypertension. Resistant hypertension is a type of hypertension that is not managed or is not controlled by using the full dose of three types of medication, three groups of medication, one of which is a diuretic. The hypertension is not usually controlled by just one medication, and usually it needs more than one medication, but if it is not controlled by the full dose of three types of medication, it is named resistant hypertension. Resistant hypertension usually can be managed by adding the fourth drug as spironolactone. Spironolactone is an aldosterone inhibitor, and it can decrease blood pressure and resistant hypertension, because there is a theory that patients with resistant hypertension have a high level of aldosterone. Finally, there are some types of antihypertensive drugs that are preferred over each other in patients with a coexisting medical condition in addition to hypertension. For example, in hypertensive patients who have chronic kidney disease, angiotensin converting enzyme inhibitors and angiotensin receptor blockers are preferred, or in those with migraine, calcium channel blockers and beta blockers are preferred. Or similarly, in patients with coarctation of aorta, beta blockers are preferred over other types of antihypertensive drugs. Also, in congestive heart failure, beta blockers, angiotensin receptor blockers, angiotensin converting enzyme inhibitors, and loop diuretics can be used. Calcium channel blockers are also preferred in kidney transplantation. I wanted you to be familiar with the different types of antihypertensive drugs. I know that you may have been confused after receiving this load of information, but it is not necessary to memorize all of them, and just the landscape of the topic is enough for patients or even for medical students. If you enjoyed this video, please don't forget to like, subscribe, and comment. See you soon.